Well, right now, there is a growing health crisis in Black women, maternal mortality. Data shows in 2021, 70 Black women died per 100,000 live births. That's nearly 3 times the rate of white women. So we have certified nurse midwife Jessica Anderson joining us now to talk about why. Thank you so much for being here with us. We appreciate it, Jessica.
Yeah, of course.
Yeah, well, firstly, tell us a little bit about what you do for pregnant women.
Yeah, so I'm a certified nurse midwife at the University of Colorado Hospital, where we provide care to people, pregnant and postpartum people, outside the hospital, but also for their birth during their hospital admission.
And, you know, the data that we just talked about, we just shared, is really staggering. Talk to me about why there is such an issue with this and discrepancy with Black women versus white women.
Yeah. So we know there's several reasons. So
Yeah.
one, just the structural racism that exists within our healthcare systems, implicit bias, and also just a difference in the quality of care that is provided to pregnant and postpartum people of color.
And a lot of stress, right? A lot of fear even around this. How can women be aware of the risk if they are pregnant and expecting?
I think the just seeing in the media, people are aware and do come into pregnancy with a fear of being harmed or dying. And I think what I tell people is to prepare themselves with education, with a great support system, which could be family, friends, but also the right system or right hospital or provider team as well. So kind of going into it with education and making sure you're surrounded by people that are going to support you 100%.
And, you know, Jessica, too, what is your best advice for Black women who feel like their concerns aren't being heard?
To use your voice, to never stop asking the questions, to not sharing, to share your fears, to share when something doesn't feel right, doesn't look right, and also equipping the people that surround you to advocate for you as well.
And Jessica, too, anything else you want to add or that would be pertinent information for women who are watching?
Yeah, I think just going back to finding the right healthcare team to support you, the right hospital, the right support system, you know, knowing the data that exists within our states regarding different providers. So I think it all comes down to getting the right type of education.
Perfect.
And knowledge.
Absolutely.
Yeah.
Jessica, thank you so much for this incredible information. Very important. We hope it's helpful for our viewers and it raises awareness about this important topic. So remember, you can watch this interview again and find more info at cbscolorado.com.